introduction so ordered, I now recognize Dr. McDermott, Ranking Member, for his opening statement.
Thank you, Mr. Chairman. I suppose we could spend the morning talking about how and why the policy was changed and how it was announced. I might have preferred a different approach, but it's not my job to speculate on best practices for the White House. It's our job, actually, to continue to shape and guide reform so that it best serves the American people, to focus on policy, not on politics. There's been a lot of noise on both sides of the aisle over what this shift means, but nobody really knows. I didn't spend my 4th of July combing over the implications of the change, and I doubt there's anybody on the dais who did. I'm trying to adjust and dissect this plan on the back of a galloping horse before we have a chance to properly consider it. Is, believe me, unwise. 3 days, we're back in session 2 days, and here we are having a hearing on something that was announced before the 4th. I'm sure it's tempting for those who have stood against reform and progress from the beginning to see this as a chance to rip Obamacare apart again yet another time. The irony of objecting to the delay of a program you've been trying to stop is no doubt lost on this room. We're even going to get a 38th vote shortly to repeal it, so you know where one half of this room is coming from. The fact is, Obamacare is largely unaffected by the delay. It was always designed to be built on current coverage and fill in the gaps. The employer responsibility requirements are just a piece of that puzzle that make up universal coverage. The marketplace exchanges are on track to open on March 1. My state is well out there. I've been talking to people over the 4th of July, and they are raring to go. There are many places in this country who have geared up for this. Places like Texas haven't. That's another issue. States' premium filings are coming in lower than expected in Washington, California, and other states. Oregon's 2014 filings show premiums slashed by as much as 35%. Reality dramatically contradicts the rhetoric that you hear in here. We don't know exactly what the land looked like in January, but it is entirely possible that this decision will actually help consumers. They'll have a chance to have access to the exchanges. Employees who remain uncovered will be able to find assistance through tax credits and other subsidies in the federal marketplace or the state exchange. The delay will also give businesses time to adjust and for the community to work with Treasury to work out the most efficient and effective way to comply with the law. For 95% of the employers who already offer coverage to their employees, we have every reason to believe they will continue to do so. Microsoft, Amazon, Boeing, they're not going to stop offering to their people. Massachusetts saw no drop in employer coverage under Romneycare. In fact, in the 7 years since its implementation of universal health insurance, employer coverage has actually increased slightly. But more importantly, it's better for us to delay this and get it right than to rush and get it wrong. Now, I'd like to put it in a little historical context here. In 1966, when I was in the beginning of my medical practice, medical workers were traveling door to door, Medicare workers were traveling door to door trying to enroll seniors. With 100 million leaflets that were printed before the bill was signed into law or passed out of the Congress. They printed those, they were already up and running. They got a jump start. And they printed it without appropriated funds. And usually those doors were slammed in their face. The American Medical Association denounced the program as the first step towards socialism, and agency administrators wondered if hospitals would be overrun with the sick and the elderly patients stretching out for blocks. You can read this in the history. I'm not making this up. This is what was going on in 1966. The Bureau of Health Insurance began operating without oversight and often with regard to formal requirements of rulemaking, simply hoping things would fall into place. 47 years later, Medicare is the bedrock of our social safety net. It is the standard bearer of a government that works. And a big part of what saved us then was that everyone was working together to get it off the ground. Congress intentionally wrote flexible conditions, and the administration was allowed to make changes as they saw fit. They were willing to take chances to ensure success. Now, let's consider the path before us. before we burn the bridge behind us. The president isn't going to reverse this decision, so nothing that happens here today is going to make any difference. So let's see where it goes. And then, more importantly, let's remember to whom we are accountable. It's not pollsters or cable news anchors or the president's campaign team. Our only job in this committee is to fulfill the promise to American citizens of affordable health care. And we're having this hearing to hear from you why this isn't going to work. That's what it's all about. The supposition of this hearing is that it's all over. It's dead. Let's see if that's true. I yield back the balance of my time.